Immediately after surgery, when I stood up, my surgeon noticed that I had a hernia. She did tell me to wear a New Hope belt, one of the hernia belts, sort of like a girdle type thing, but with a hole in it for the ostomy to go through. So I wore that, and I ended up needing a new one after a while because my stoma swelled and got bigger. So I tried on different stoma belts and rented one or used one from the local drug supply store before mine was getting in. I tried that one on August 8th, and I wore it for probably about 4 or 5 hours and was having a perfectly fine day. Went to bubble tea, got a smoothie, just having a really good time. Then I get home and I take off the belt so I can go empty my bag, and notice that my stoma was sticking out a little bit. And it probably was sticking out about like this much. I wasn't prepared for a stoma prolapse, but I knew what rectal prolapse looked like because I had it, and that's basically what was happening. So I was terrified, and that was only 3 weeks after I had surgery. So that was way sooner than I ever expected to have problems. It was a surprise for sure. August 9th is my birthday, so I spent my whole birthday miserable. I was put on bed rest, and I was on the couch. I had to lay on the couch flat. I couldn't even move to the side because my stoma would come out even more every time I did that. Plus, the pain started after a few hours of it sticking out a little bit. It came up more and more and more. And when it did that, the pain increased immensely. It was an awful experience. I was on Valium to calm me down and to relax my muscles while I was laying down, with the hope that it would just go back in on its own. It wasn't going back in. I had a home care nurse, and she couldn't get it back in either. She was like afraid to get it back in by that point because it was so swollen. That night I ended up going to the hospital. I stayed in the hospital for 3 days. It was miserable. I'm just gonna be honest. They tried sticking it in like 5 times in the ER with just medicating me. I wasn't sedated or anything. They said the medication, it was like 11 doses of morphine and a few of Versed, and it was just a lot of medication. They said most people are kind of in like a twilight, or they don't really realize what's going on, but for me, the pain was just so bad. I would scream and like jump every single time they'd go to push it in. And with a prolapse, it's like a inside out sock, so you have to like, it's swollen, you have to push it inside of itself. Like, it just wasn't going. They ended up taking me to the OR and pushing it back in there, and then I stayed in the hospital for 3 days, for I think, yeah, 3 days after that. And it was really painful still, even after that. It looked really good afterwards and everything, but that surgeon who put it back in wasn't my surgeon from Mayo Clinic, and she said, you know, you better go back, and this is just going to keep happening to you. And my surgeon at Mayo Clinic told me that she didn't think that would necessarily happen. That's not true. It could just prolapse once and then never again. Just be careful. My stoma ended up prolapsing again, and it was just little by little. It was sticking out just a little bit, and my surgeon said every time that happened to stick it back in. She taught me how to do it, and she told me to use sugar, which I realized sometimes helps with, I don't know, the swelling. It helps get the stoma back in for some people. For me, it really didn't help very much. We tried it in the beginning, but bag changes were very difficult with a stoma prolapse. My surgeon wasn't really willing to do anything else after that point, and I was able to live with it if it was just sticking out a little bit. So I did. I needed my mom's help every time I had to change my bag. I would be laying down on my bed, flat, over like one of the trucks, and she would put on gloves and she would push it in for me. I would just have to relax and try not to be frustrated with it whenever output would leak out. It was just a gross mess, but I dealt with it. I was hoping my 20th birthday would bring a fresh new year of healthiness and happiness, and it just didn't, and it ended up being like the worst day of my life. We actually decided to celebrate my birthday a few weeks later and just postpone it because it just didn't seem fair that I was laying in pain all day long and then in the hospital. My surgeon at Mayo Clinic ended up referring me to a surgeon locally to take things on from that point. And after a consult, he discussed my options, and he said that he would fix my stoma and switch it to an end loop ileostomy, which is different than what I had before. My previous stoma was a traditional loop. The end loop is similar. You can't find that much research, or at least I couldn't find a whole lot of research on it, but it looks like an end ileostomy from the naked eye. But then when you lift up the stoma a little bit, there's a tiny, tiny little hole right below. So it is technically a loop ileostomy. He said that should prevent future prolapses, at least for a while. It could always happen, but it should help. He would also repair my hernia, that he would repair the rectal prolapse. He would pretty much do the same as what happened the first time. And in my first surgery, I had a foot of my colon removed and then my rectum, I think, stitched up to my sacrum, like your lower backbone. I did have rectal prolapse again 2 months after the first surgery, so I wasn't sure if I should really trust what the surgeon was saying, but he was very confident that the surgery would work. He also wanted 2 tests done before I had surgery, a colonoscopy and then a repeat defecogram done. So I scheduled the colonoscopy, had that done like the mid to late September, and then the next test was to be scheduled for the following week, where I was planning to schedule surgery soon as well. But my surgeon said if something did happen, and if it did prolapse again, to come back to the ER at his hospital and he would put it back in and actually fix everything this time, not just stick it in. He would actually do the whole surgery, minus the rectal prolapse part. He would not do that part unless I had the test done so we knew how much of my colon to remove. So, unfortunately for me, on September 30th, I was working on homework, not doing anything strenuous at all. Thought I was having a normal life for once, and I was getting a lot of abdominal pain. I was drinking hot chocolate, so I'm like, maybe my stomach just hurts from the hot chocolate. Well, my stoma actually ended up prolapsing even more so when I finally did look at it. My mom ended up taking me to the ER. By that point, I was in excruciating pain all over again. It was really awful. And my surgeon wasn't on call that night. There ended up being 3 other emergencies, and the other colorectal surgeon couldn't come in and fix it or do anything other than give me morphine. So they admitted me to the hospital, and my surgeon's next big operating day was Wednesday, and I was admitted on a Sunday night.